Thank you, Acting President. I'm pleased to stand with the Nationals in support of this motion. Paramedics and the work of people in that area is just so critical to particularly people in regional Victoria. A member of my family, their life was saved after suffering heart failure. They live in a regional area, and it was a paramedic, a MICA paramedic, that came and assisted. And I, from a personal perspective, just want to say how thankful I am for the training and the quick response that happened on that day that saved their life. But I know that's not the situation for many, many others. And I remember, and I raised this in the Parliament in my first year back in 2023, of a family that I'd heard from in Donald, where they needed an ambulance just 200 metres from the hospital, and yet they had to wait hours for an ambulance. And unfortunately, that family member passed away the next day. I've spoken to many other people who have been in contact with me to raise concerns about no ambulance being available, about being told they had to get a taxi to get to the hospital, and yet they live so close to Bendigo in that situation. Others where no ambulance was available and they had to take their loved ones themselves, often in significant pain and distress, to hospital. I've also raised time and time again the issues that I know are happening in our region of Northern Victoria because of the ramping time, or the ramping that's happening at our hospitals. We're seeing that in Wodonga, we've seen it in Bendigo, in Shepparton, and so much time being wasted by ambulance that need to stay there and not being able to get out again onto, being able to respond to emergency situations. And I know that this is also an added pressure is the lack of aged care services that we have in regional areas, and people that end up having a bed in a hospital because there's simply nowhere for them to go, and the delays in the assessment times. I know there was a Productivity Commission report just recently that was talking about the extensive delays to getting aged care assessments, which is obviously contributing to that as well. But I know that that's been an issue in Albury-Wodonga Hospital, as I visited there last year, and I know in Bendigo I heard too that there was local professionals were talking about there was 42 beds being taken by people that needed really aged care services. But this is the challenge that we are facing, and yet we do have a number of paramedics being trained in Victoria. I received information from Andrew McDonald, who's with HMS Community Home Care and Clinic, yes, and they're based in Gisborne, and they were talking about in Australia there's 15 universities offering a paramedic undergraduate degree with a cohort of about 5,000 students across the country, but there's not the placements to enable that training, and this is causing a significant number of degree-qualified paramedics to remain without work, and this is getting worse year on year. And I've spoken to people that know many of their fellow students that have now moved overseas to find work. They're not staying here in Victoria. Some have ended up working in gardening businesses, others have ended up working in supermarkets, and it is extraordinary to me when I see the need that we have for paramedics to be working in our regional communities where health services are lacking, and that divide between the regions and what we see in the city and the life expectancy, there is a big gap there still, and we need to address that. And to think that we have trained paramedics and yet here we have ambulance response times that are not where they should be. And I know, speaking with residents up at the Indigo Shire, that is one of the worst response times for ambulances in the state, and it continues to be. I've also raised in this chamber concerns about there was a rolled ambulance after apparently it was an 18-hour shift that they had done, and they had an accident. And I think this is just some of what we're seeing because of the pressure that's in our system at the moment. And yet here we have the the Labor government have been in now since 2014. And yet the issues continue, and we see the wrong priorities that this government has. And I know that Ms Crozier spoke about that in her contribution, and that's referenced in this motion as well. But currently Victoria does have the highest taxes, the highest debt. We are paying nearly $1 million every single hour just in interest repayments. And here we have, as this motion refers to, shifts that can't be filled simply because of the financial constraints, because we have a government that continues to waste funds, absolutely waste funds. And they certainly don't treat the taxpayers' money like their own money, because we have seen millions wasted with the cancelling of the Commonwealth Games. We've had millions spent on machete bins, hundreds of thousands of dollars spent to lease pot plants for the Suburban Rail Loop Authority, and over $50 billion on project blowouts in this state. So that is the situation we're in, and yet we know that in regional areas it is so important that we have better, improved response times and have paramedics that are productively employed to contribute to better health care in our regions. But certainly I'm looking forward to November. I'm so glad that 2026 is finally here, because we have a state election coming up and people will get to choose who they want to lead this state. And we have seen the record of this government, and I can assure you that a Liberal Nationals government is absolutely committed to delivering a world-class health system that Victorians can rely on. Thank you.